Well, welcome back, everybody, to Good Day Maine. And this guy over here is known as Maine's Mustache Man, Lou Jacobs. Welcome back to our show. Thanks for joining us, as well as your good friend, Dr. Inhorn here, an oncologist with Mercy Hospital, to talk about inflammatory breast cancer. And Doctor, before we get a little bit more detail about that, we just want to reintroduce Lou and your Mystache Fights Cancer fundraiser. Tell us a little bit about what you're doing right now.
I'm raising money with my mustache and other people's facial hair as well. It started last year, about a year ago, when my mother was diagnosed with inflammatory breast cancer. I started growing the mustache because I thought that it would be fun, but I also thought it was just a good time to sort of live a little bit more like this is really living, but it kind of is. And,
absolutely.
And so we're raising money, myself trying to raise $5,000 for the Cancer Community Center or more, as well as the Inflammatory Breast Cancer Foundation. Other people can join. There's a website you can go to, and you can sign up, and you can grow a beard, grow hair on the top of your head, grow a mustache, and people can donate to the cause.
Okay,
so
and
it's
how
a different way.
Do you have a timeline here, or?
Yep, the end of the project is January 1st.
Okay.
So up until then, people can join and grow and receive donations based on their growth.
And if you get to $5,000 or more, you'll shave the mustache.
Yeah, if the $5,000 is in favor of me shaving. If the $5,000 is, and it seems right now we've got a lot of people that want me to keep it.
Oh no,
so,
and to your wife,
yeah,
your wife is not really a fan here.
That's
a fan
right.
of the fundraiser, just not a fan of the mustache.
I may
maybe.
shave it anyway to restart, because we'll do this program again next year, so I may shave it and restart the growth.
So is this something you want to continue?
I think it's something that we're, yeah, it's gotten a really fantastic response, and I think that it will really catch on and be one of the best, if not the best, non-athletic cancer fighting fundraiser in the state.
Well,
so,
there you go.
Yeah.
Well, you know, you have a very unique story with your mom. She, you know, as I remember you telling me, it was very sudden, the inflammatory breast cancer. So I think, Doctor, you can come in maybe a little bit just to talk about the uniqueness of this type of cancer.
Sure. Inflammatory breast cancer is a condition where the cancer cells actually invade the skin and the tissues underlying the skin of the breast. And so the breast becomes inflamed and red, which is where the name inflammatory breast cancer comes from. But it's a very dramatic presentation for breast cancer. The skin oftentimes puckers in and looks like the peel of an orange, which is referred to as peau d'orange in the cancer community. And so it can be confused as an infection. And in fact, I'd say that most people who present with reddened skin of the breast, the most common cause of that would in fact be an infection. But certainly any woman who sees reddened skin should seek medical attention immediately, and if that does not improve with a course of antibiotics, inflammatory breast cancer needs to be considered as a possible cause.
Is it difficult to detect? I know with your mom, she wasn't really sure what it was.
Yeah, and she was pretty well versed in health-related issues. She had a degree in health education. She certainly knew to do breast exams, and she was playing in front of the mirror pretending that she was a famous, well-endowed woman that we all know of. And she noticed this change, and she called me and she said, what do you think this is? And of course, going back to my studies at peau d'orange that Dr. Inhorn was talking about, is like a hallmark for at least raising a red flag that this could be something. And I was like, oh, well, and go in and get checked. And she went in and got checked, and it wasn't the more common infection. It was the worst scenario. So. And
what can you tell women and men, you know, about the prognosis, about treatment, about your timeline, things like that?
Well, inflammatory breast cancer is a more aggressive kind of cancer, and it's very hard to perform primary surgery because of the involvement of the skin. It can be difficult for a surgeon to remove the affected tissue and then get good surgical closure. So the treatment paradigm is oftentimes reversed, that instead of performing surgery first, which would be typical in a patient with breast cancer, we oftentimes administer chemotherapy first with the goal of shrinking the tumor, getting the cancer out of the skin so that a person can then move on with surgery and radiation therapy.
Okay. Well, guys, thank you so much for sharing that story. And Lou, continue to raise money, and everybody support him. Mystache Fights Cancer. Again, where can they go here to learn more?
So MystacheFightsCancer.com is the website, and from there are a bunch of links. You can, at the top of the page, you can say that you want to donate or you want to join the fight, and it will link you to a website that will help you get involved. So certainly anybody with facial hair that's always wanted to use it for some good, now's your opportunity.
Yeah, and check out these cards around town here. The big muscles in the mustache, that's Lou.
That's
so
right.
check it out. And also these guys will be back to talk about some more different types of cancers, treatments, things like that. So if you have any questions about any type of cancer, please email me and I'll bring it to these guys. So next month we can maybe touch upon some of yours questions.
Thank
All
you.
right, guys.
Thank
Thanks
you.
a lot, Sarah. We'll send it over to you.